Hi, this is Daniel DiTuro. Are you frustrated by the high cost of prescription drugs? In this video, I'll share the world's highest prescription drug prices, Big Pharma wrote Medicare Part D laws, putting wealth and profit before people, the doctor prescription drug monopoly, insurance company formularies, generic versus patented drugs, and online pharmacy risks. The high cost of prescription drugs contributes to the U.S.'s high healthcare costs. Virtually all drugs available in the U.S. are made by for-profit drug companies. A study published in 2020 showed drug company profits were almost double non-drug company profits. U.S. prescription drug costs have risen from $195 billion in 2002 to over $500 billion in 2020. During that period of time, drug companies averaged about $100 billion a year in net profit. Another contributor is the U.S.'s high usage of prescription drugs. The U.S. has about 5% of the world's population and consumes about 45% of the world's prescription drugs. About 45% of the U.S. population uses prescription drugs. That includes 18% of children under the age of 12 and 85% of adults 60 and over. Medicare alone spends about $130 billion a year on prescription drugs, with some senior Americans taking 6 or more daily. Before enacting Medicare Part D prescription drug coverage, many senior Americans could not afford prescription drugs. Today, with Medicare Part D and Medicare Advantage plans, many senior Americans still cannot afford prescription drugs. Millions of Americans must decide between paying for prescription drugs, food, and housing. One reason Medicare spends $130 billion a year on prescription drugs is because the legislation creating the Medicare Prescription Drug Program, Part D, does not allow Medicare to negotiate prescription drug prices. Private insurance companies use formularies and negotiated drug prices to reduce prescription drug expenses. The U.S. military has the authority to negotiate prescription drug prices. Countries with universal health care regulate prescription drug prices. But Medicare Part D legislation was written by the drug industry to benefit the drug industry. Several authors of Medicare Part D left their low-paying government jobs for pharmaceutical company jobs, paying over $1 million a year. Even with Medicare Part D and Medicare Advantage plans, many senior Americans either do not fill their prescriptions, ration their medications, or have their prescription filled in Canada or Mexico, where drug prices are regulated. Like most businesses, drug companies are in business to make a profit. Thanks to the not-so-free market American Wealthcare system, essential drugs, like a vial of insulin that cost $20 in 1990, costs up to $300 in 2020. In countries with regulated drug prices, a vial of insulin still costs about $20. Type 1 diabetics must have insulin to control their blood sugar. Many diabetic Americans cannot afford the high price of insulin. Before passing the Affordable Care Act, diabetics were denied private health insurance due to diabetes, a pre-existing condition. While liberals in Congress want to regulate prescription drug prices, most conservatives do not. Conservative politicians insist only an unregulated pharmaceutical market will drive down prescription drug prices. At least, that's what the drug companies financing their political campaigns tell them to say. Even now, the prescription drug market is not a free competitive market. For decades, Americans had no access to prescription drug costs. Most prescribers have no idea how much the drugs they prescribe cost, or if the drug is covered by the patient's insurance. A drug covered by one plan's formulary may not be covered by another. In a competitive free market, insulin prices would not increase over 1,000% in 30 years. Imagine a smartphone that retailed for $500 in 2007, costing $3,500 today with the same processor and memory. It's not uncommon for new drug therapies to cost between $50,000 and $200,000 a year, but most insurance company formularies exclude expensive new drugs. In the U.S., a prescription is required to legally obtain controlled drugs. The prescription can be written by a doctor, nurse practitioner, or physician's assistant. Nurse practitioners and physician's assistant can have as little as 1 year of training. By comparison, it can take up to 10 years of postgraduate education and training to become a doctor of pharmacy. But doctors of pharmacy are prevented by law from dispensing drugs without a doctor's prescription. In many countries, pharmacists have dispensed some drugs without a doctor's prescription for decades. That saves the time and expense of seeing a doctor for minor illnesses like allergies, rash, or pulled muscles. Although pharmacists do not know your medical history like your doctor, unlike your doctor, pharmacists know a drug's cost and which drugs are in your formulary. If Americans can buy prescription drugs from online pharmacies without their doctor's prescription, why not from a local pharmacist? Allowing local pharmacists to dispense drugs without a prescription would reduce a medical practice's revenues. State legislatures write the laws governing dispensing prescription drugs. They can change the law and allow doctors of pharmacy to dispense some drugs without a prescription. But do not hold your breath that will happen anytime soon. Corporate medical practices will lobby against it. Like healthcare in general, prescription drug prices have increased dramatically. Drug companies and pharmacies can charge whatever price the market will bear. With U.S. Wealthcare, a 30-day supply of a generic prescription drug can cost $30 at one pharmacy and $150 at another. This generic prescription antihistamine retails for over $300. A person working 40 hours a week for minimum wage makes $290 before taxes. Many minimum wage workers have no prescription drug coverage. Americans with prescription drug insurance can still pay thousands of dollars a year. With high deductible plans, you pay the entire negotiated price until you meet your deductible. Other insurance plans have prescription drug copays for generic and non-generic drugs. Another factor contributing to high prescription drug prices is the use of credit cards instead of cash. Paying the minimum credit card balance each month conceals the true impact of high prescription drug prices. Before corporate managed care, doctors decided what drugs to prescribe based on their experience and diagnosis. All that changed with managed Wealthcare. Today, insurance company executives use third-party companies to decide what is included and excluded in their drug formularies. For Americans with health insurance or Medicare Part C and D, prescription drug availability and cost are controlled by formularies. A formulary is a list of drugs that need or do not need pre-authorization and are assigned cost tiers and restrictions. Formularies are designed to save the insured and insurance company money by encouraging the use of less expensive generic drugs. Lower tier drugs reduce out-of-pocket costs. In addition to tier levels, formularies may include age restrictions and quantity limits. New drugs are patented, giving the patent holder exclusive rights to make and sell the drug for 20 years. When the patent expires, any drug company can make and sell a generic version of the drug. Generic drugs are sold by their chemical name because trademark brand names never expire. Generic drugs are approved by the FDA and require a prescription. In some cases, drugs with expired patents can be sold without a prescription. The FDA determines if a non-prescription drug can be sold full or reduced strength. Before any generic drug can be sold, the maker must prove its efficacy is the same as the patented drug. Some Americans are now using online pharmacies to save money or to avoid discussing embarrassing conditions with their doctor. Buying drugs from licensed online pharmacies still requires a prescription. Online pharmacies use staff doctors, nurse practitioner, or physician's assistants to diagnose and prescribe their drugs. But staff prescribers can have a conflict of interest. Is the prescriber concerned about your health or their employer's financial health? A 5-minute online consultation is not the same as seeing a doctor who knows your medical history. There is a difference between using an online pharmacy to save money on drugs prescribed by your doctor and using an online pharmacy to diagnose and treat a medical condition. Thanks to the internet, fake pharmacies use spam emails and texts offering low-priced generic prescription drugs. Fake pharmacies allow you to buy drugs without a prescription, offer prices that are too good to be true, send unsolicited emails for cheap drugs, are located outside of the United States, and are not licensed in the United States. The risks of using a fake online pharmacy is that they could supply counterfeit or substandard drugs, drugs with the same name but different formula, and you risk having your personal information stolen. Like the old saying, if it sounds too good to be true, it probably is. Please leave a comment if you have any questions about this video. Thank you for watching.